Hey there, health enthusiasts! We are thrilled to have you back with us. Welcome back to Visions Beyond, your go-to source for all things health. Whether you're a longtime follower or a new viewer, we're here to provide you with the latest and most reliable health information. Today, we're tackling a topic that's close to our hearts, Charcot joint, a complication of diabetes that can really impact your quality of life. This condition, also known as Charcot foot, can be quite daunting, but don't worry, we're here to break it down for you. Now, we know what you might be thinking. Charcot joint sounds like something from a medical textbook. And you wouldn't be wrong. It's a term that often leaves people scratching their heads, and you know what? You're not wrong. But don't let the medical jargon scare you away. Understanding Charcot joint is crucial, especially if you or a loved one is living with diabetes. Here at Visions Beyond, we believe in making even the most complex medical conditions easy to understand. Our goal is to empower you with knowledge so you can take control of your health. Because knowledge is power, right? When you understand what's happening in your body, you can make informed decisions and take proactive steps to manage your health. So buckle up as we break down Charcot joint in a way that's both informative and engaging. We'll cover everything from the basics of what it is, to the symptoms, causes, and most importantly, how it can be managed. Trust us, by the end of this video, you'll be a Charcot joint whiz. You'll not only understand this condition better, but also feel more confident in discussing it with your healthcare provider. So let's dive in and explore the world of Charcot joint together. Let's get down to brass tacks. What is this Charcot joint anyway? It's a term that might sound foreign to many, but it's crucial to understand, especially if you or someone you know is dealing with diabetes. So, what exactly is Charcot joint? Well, it's a condition that primarily affects the joints in your feet, but it can also impact other weight-bearing joints. It's named after Jean-Martin Charcot, a French neurologist who first described the condition in the 19th century. In simple terms, Charcot joint is a progressive condition that leads to the weakening of bones in the foot. This happens due to significant nerve damage, often associated with diabetes. Imagine this. Your joints are like a well-oiled machine working smoothly and effortlessly. Every step you take is supported by this intricate system of bones, muscles, and nerves working in harmony. Now, picture Charcot joint throwing a wrench into this beautiful system. This wrench comes in the form of nerve damage, which disrupts the normal functioning of your joints. This nerve damage is a common complication of diabetes. When the nerves in your feet are damaged, they can't send the right signals to your brain. This means you might not feel pain or discomfort the way you should. See, diabetes can mess with the nerves in your feet, leading to a loss of sensation. This loss of sensation is like having a faulty alarm system in your body. You don't get the warning signals when something is wrong. And when you can't feel your feet properly, it's like walking around with blindfolds on. You can't see the obstacles in your path, making you more prone to injuries. You're more prone to injuries, but because you can't feel them, you keep going, further damaging the joint. This continuous damage can lead to severe complications. This leads to inflammation, fractures, and even deformities. The bones in your foot can become so weak that they break easily, and the joints can dislocate. Not exactly the recipe for happy feet, right? It's a painful and debilitating condition that requires immediate medical attention. Early diagnosis and treatment are crucial to prevent further damage and to manage the symptoms effectively. Treatment often involves immobilizing the foot to prevent further injury, using custom footwear, and in some cases, surgery. Managing blood sugar levels is also essential to prevent the progression of nerve damage. With the right care and attention, people with Charcot joint can lead a fulfilling life. It's all about understanding the condition and taking proactive steps to manage it. Now, you might be wondering, how do I know if I have Charcot joint? This is a common question, and it's important to be aware of the signs and symptoms early on. Well, that's where things get a little tricky. Charcot joint, also known as Charcot foot, can be quite deceptive in its early stages. You see, Charcot joint can be a bit of a sneaky villain. It often starts subtly, making it easy to overlook the initial warning signs. It often disguises itself as something less serious, like a sprain or a simple foot infection. This can lead to delays in seeking proper medical attention. But don't worry, we're here to equip you with the knowledge to spot the red flags. Being informed is your first line of defense. Keep an eye out for these telltale signs: redness, swelling, and warmth in your foot, especially if it's unexplained. These symptoms can be early indicators of Charcot joint. Also, If you notice any changes in the shape of your foot or ankle, like unusual bumps or deformities, it's time to sound the alarm. These changes can indicate that the condition is progressing. Remember, early detection is key when it comes to managing Charcot joint effectively. The sooner you catch it, the better your chances of preventing severe complications. So, what should you do if you suspect you have Charcot joint? First, don't panic. Make an appointment with your healthcare provider as soon as possible. They can perform the necessary tests to confirm the diagnosis. Your doctor may order imaging tests like X-rays or MRIs to get a clear picture of what's happening inside your foot. These tests are crucial for an accurate diagnosis. Treatment for Charcot joint often involves immobilizing the foot to prevent further damage. This might include wearing a cast or a special boot. In some cases, surgery may be necessary to correct severe deformities. Rehabilitation and physical therapy are also important components of recovery. These therapies can help restore function and strength to your foot. Additionally, managing underlying conditions like diabetes is crucial. Keeping your blood sugar levels in check can significantly reduce the risk of developing Charcot joint. Remember, you're not alone in this journey. Support groups and communities can provide valuable emotional support and practical advice. With the right knowledge and support, you can manage Charcot joint effectively and lead a fulfilling life. Stay vigilant, stay informed, and take proactive steps towards your health. Think of Charcot joint's progression like a play, unfolding in several acts. In Act 1, the stage is set with inflammation. You'll experience warmth, redness, and swelling, almost as if your foot is putting on a dramatic performance of its own. As the curtains rise on Act 2, bone destruction takes center stage. The damaged nerves can't send pain signals effectively, so you might not even realize the extent of the damage happening beneath the surface. This is where things can get really serious. Finally, Act 3 reveals the consequences of this silent destruction. Your foot might develop deformities, like the infamous rocker bottom foot, making walking difficult and painful. It's a stark reminder of why early intervention is crucial. Now, before you hit the panic button, remember that Charcot joint is manageable, especially if caught early. Think of it as a fire. The sooner you extinguish it, the less damage it can cause. So what's the fire extinguisher in this scenario? It's a multi-pronged approach that focuses on protecting your foot and preventing further damage. This involves offloading, meaning keeping weight off the affected foot like it's a priceless artifact. Think special shoes, braces, or even crutches. In some cases, surgery might be necessary to correct deformities or stabilize the joint. But remember, the best treatment is prevention. Charcot joint might be the star of today's show, but it's not the only way diabetes can affect your joints. Remember those pesky high blood sugar levels? Well, they can wreak havoc throughout your body, including your joints. From stiff hands, also known as diabetic hand syndrome, to frozen shoulders and even an increased risk of osteoarthritis, diabetes can throw your musculoskeletal system out of whack. It's like a domino effect, with one problem leading to another. But don't fret. By managing your blood sugar levels, maintaining a healthy weight, and incorporating regular exercise into your routine, you can keep these joint woes at bay. They say an ounce of prevention is worth a pound of cure, and nowhere is this truer than with Charcot joint. The best way to manage this condition is to prevent it from raining on your parade in the first place. And how do you do that? By becoming a foot health fanatic. That's how. Inspect your feet daily for any cuts, blisters, or redness, like you're searching for hidden treasure. Keep your blood sugar levels in check, wear comfortable shoes that fit well, and see your doctor regularly for foot exams. Remember, those feet carry you through life, so show them some love. Living with diabetes is a marathon, not a sprint, and managing it effectively requires a holistic approach. This means looking after every aspect of your health, from your diet and exercise to your stress levels and sleep quality. Nourish your body with nutritious foods, get moving every day, and find healthy ways to manage stress, like meditation or spending time in nature. Remember, your body is a temple, so treat it with the care and respect it deserves. By taking a proactive approach to your health and well-being, you can keep your joints happy and healthy for years to come.